Hey Alpha Nurses, I'm Licensure from alphanursguide.com. This is 80 practice questions. Without delay, let's get started.
A 60-year-old comes into the emergency department with crushing substernal chest pain that radiates to the shoulder and left arm. The admitting diagnosis is acute myocardial infarction. Admission prescriptions include oxygen by nasal cannula at 4 liters per minute, complete blood count, a chest radiograph, a 12-lead electrocardiogram, and 2 milligrams of morphine sulfate given IV. The nurse should first 1. Administer the morphine. 2. Obtain a 12-lead ECG. 3. Obtain the blood work. 4. Prescribe the chest radiograph. The correct answer is 1. Administer the morphine. Although obtaining the ECG, chest radiograph, and blood work are all important, the nurse's priority action should be to relieve the crushing chest pain. Therefore, administering morphine sulfate is the priority action. A client has chest pain rated at 8 on a 10-point visual analog scale. The 12-lead electrocardiogram reveals ST elevation in the inferior leads and troponin levels are elevated. What is the highest priority for nursing management of this client at this time? 1. Monitor daily weights and urine output. 2. Permit unrestricted visitation by family and friends. 3. Provide client education on medications and diet. 4. Reduce pain and myocardial oxygen demand. The correct answer is 4. Reduce pain and myocardial oxygen demand. Nursing management for a client with a myocardial infarction should focus on pain management and decreasing myocardial oxygen demand. Fluid status should be closely monitored. Client education should begin once the client is stable and amenable to teaching. Visitation should be based on client comfort and maintaining a calm environment. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm shown on the electrocardiogram strip below. The nurse identifies this rhythm as 1. Atrial fibrillation. 2. Ventricular tachycardia. 3. Premature ventricular contractions. 4. Sinus tachycardia. The correct answer is 4. Sinus tachycardia. Sinus tachycardia is characterized by normal conduction and a regular rhythm, but with a rate exceeding 100 beats per minute. A P wave precedes each QRS, and the QRS is usually normal. A client with chest pain is prescribed intravenous nitroglycerin. Which assessment is of greatest concern for the nurse initiating the nitroglycerin drip? 1. Serum potassium is 3.5 milliequivalents per liter. 2. Blood pressure is 88/46. 3. ST elevation is present on the electrocardiogram. 4. Heart rate is 61 beats per minute. The correct answer is 2. Blood pressure is 88/46. Nitroglycerin is a vasodilator that will lower blood pressure. The client is having chest pain, and the ST elevation indicates injury to the myocardium, which may benefit from nitroglycerin. The potassium and heart rate are within normal range. An older adult had a myocardial infarction 4 days ago. At 9:30 a.m., the client's blood pressure is 102/64. After reviewing the client's progress notes, see the chart on PDF download, the nurse should first 1. Give a fluid challenge/bolus. 2. Notify the healthcare provider. 3. Assist the client to walk. 4. Administer Lasix as prescribed. The correct answer is 2. Notify the healthcare provider. All of the 12 p.m. assessments are signs of decreased cardiac output and can be an ominous sign in a client who has recently experienced an MI. The nurse should notify the healthcare provider of these changes. Cardiac output and blood pressure may continue to fall to dangerous levels, which can induce further coronary ischemia and extension of the infarct. While the client is currently hypotensive, giving a fluid challenge bolus can precipitate increased workload on a damaged heart and extend the myocardial infarction. Exercise or walking for this client will increase both the heart rate and stroke volume, both of which will increase cardiac output, but the increased cardiac output will increase oxygen needs, especially in the heart muscle, and can induce further coronary ischemia and extension of the infarct. The client is hypotensive. Although the client has decreased urinary output, this is the body's response to a decreasing cardiac output and it is not appropriate to administer Lasix. Which of the following is an expected outcome for a client on the second day of hospitalization after a myocardial infarction? The client: 1. Continues to have severe chest pain. 2. Can identify risk factors for MI. 3. Participates in a cardiac rehabilitation walking program. 4. Can perform personal self-care activities without pain. The correct answer is 4. Can perform personal self-care activities without pain. By day 2 of hospitalization after an MI, clients are expected to be able to perform personal care without chest pain. Severe chest pain should not be present on day 2 after an MI. Day 2 of hospitalization may be too soon for clients to be able to identify risk factors for MI or to begin a walking program. However, the client may be sitting up in a chair as part of the cardiac rehabilitation program. The nurse is caring for a client diagnosed with an anterior myocardial infarction 2 days ago. Upon assessment, the nurse identifies a systolic murmur at the apex. The nurse should first: 1. Assess for changes in vital signs. 2. Draw an arterial blood gas. 3. Evaluate heart sounds with the client leaning forward. 4. Obtain a 12-lead electrocardiogram. The correct answer is 1. Assess for changes in vital signs. Infarction of the papillary muscles is a potential complication of an MI causing ineffective closure of the mitral valve during systole. Mitral regurgitation results when the left ventricle contracts and blood flows backward into the left atrium, which is heard at the fifth intercostal space, left midclavicular line. The murmur worsens during expiration and in the supine or left side position. Vital sign changes will reflect the severity of the sudden drop in cardiac output, decrease in blood pressure, increase in heart rate, and increase in respirations. A 12-lead ECG views the electrical activity of the heart, and echocardiogram views valve function. When administering a thrombolytic drug to the client who is experiencing a myocardial infarction and who has premature ventricular contractions, the expected outcome of the drug is to 1. Promote hydration. 2. Dissolve clots. 3. Prevent kidney failure. 4. Treat dysrhythmias. The correct answer is 2. Dissolve clots. Thrombolytic drugs are administered within the first 6 hours after onset of an MI to dissolve clots and reduce the extent of myocardial damage. A client with acute chest pain is receiving IV morphine sulfate. Which of the following results are intended effects of morphine? Select all that apply. 1. Reduces myocardial oxygen consumption. 2. Promotes reduction in respiratory rate. 3. Prevents ventricular remodeling. 4. Reduces blood pressure and heart rate. 5. Reduces anxiety and fear. The correct answers are 1. Reduces myocardial oxygen consumption. 4. Reduces blood pressure and heart rate. And 5. Reduces anxiety and fear. Morphine sulfate acts as an analgesic and sedative. It also reduces myocardial oxygen consumption, blood pressure, and heart rate. Morphine also reduces anxiety and fear due to its sedative effects and by slowing the heart rate. It can depress respirations. However, such an effect may lead to hypoxia, which should be avoided in the treatment of chest pain. Angiotensin-converting enzyme inhibitor drugs, not morphine, may help to prevent ventricular remodeling. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm on the monitor. See the electrocardiogram strip below. The nurse should 1. Notify the physician. 2. Call the rapid response team. 3. Assess the client for changes in the rhythm. 4. Administer lidocaine as prescribed. The correct answer is 3. Assess the client for changes in the rhythm. The client is experiencing a single PVC. PVCs are characterized by a QRS of longer than 0.12 second and by a wide, notched, or slurred QRS complex. There is no P wave related to the QRS complex, and the T wave is usually inverted. PVCs are potentially serious and can lead to ventricular fibrillation or cardiac arrest when they occur more than 6 to 10 in an hour in clients with myocardial infarction. The nurse should continue to monitor the client and note if the PVCs are increasing. It is not necessary to notify the physician or call the rapid response team at this point. Lidocaine is not indicated from the data on this ECG. A client is receiving an IV infusion of heparin sodium at 1,200 units per hour. The dilution is 25,000 units per 500 milliliters. How many milliliters per hour will this client receive? The correct answer is 24 milliliters per hour. To solve this problem, first, calculate how many units are in each milliliter of the medication. The questions gives us 25,000 units per 500 milliliters. 25,000 units divided by 500 equals to 50 units. 500 milliliters divided by 500 equals to 1 milliliter. So it's 50 units per 1 milliliter. Next, calculate how many milliliters the client receives per hour. Since the client is receiving 1,200 units per hour and there is 50 units per 1 milliliter, we divide 1,200 by 50, which equals to 24. So the client is receiving 24 milliliter per hour. A client admitted for a myocardial infarction develops cardiogenic shock. An arterial line is inserted. Which of the following prescriptions from the healthcare provider should the nurse verify before implementing? 1. Call for urine output less than 30 milliliters per hour for 2 consecutive hours. 2. Metoprolol 5 milligrams IV push. 3. Prepare for a pulmonary artery catheter insertion. 4. Titrate dobutamine to keep systolic BP greater than 100. The correct answer is 2. Metoprolol 5 milligrams IV push. Metoprolol is indicated in the treatment of hemodynamically stable clients with an acute MI to reduce cardiovascular mortality. Cardiogenic shock causes severe hemodynamic instability, and a beta blocker will further depress myocardial contractility. The metoprolol should be discontinued. The decrease in cardiac output will impair perfusion to the kidneys. Cardiac output, hemodynamic measurements, and appropriate interventions can be determined with a PA catheter. Dobutamine will improve contractility and increase the cardiac output that is depressed in cardiogenic shock. An older adult has chest pain and shortness of breath. The healthcare provider prescribes nitroglycerin tablets. What should the nurse instruct the client to do? 1. Put the tablet under the tongue until it is absorbed. 2. Swallow the tablet with 120 milliliter of water. 3. Chew the tablet until it is dissolved. 4. Place the tablet between the cheek and gums until it disappears. The correct answer is 1. Put the tablet under the tongue until it is absorbed. The client is having symptoms of a myocardial infarction. The first action is to prevent platelet formation and block prostaglandin synthesis. The client should place the tablet under the tongue and wait until it is absorbed. Nitroglycerin tablets are not effective if chewed, swallowed, or placed between the cheek and gums. The nurse is monitoring a client admitted with a myocardial infarction who is at risk for cardiogenic shock. The nurse should report which of the following changes on the client's chart to the physician? 1. Urine output. 2. Heart rate. 3. Blood pressure. 4. Respiratory rate. The correct answer is 1. Urine output. Oliguria occurs during cardiogenic shock because there is reduced blood flow to the kidneys. Typical signs of cardiogenic shock include low blood pressure, rapid and weak pulse, decreased urine output, and signs of diminished blood flow to the brain, such as confusion and restlessness. Cardiogenic shock is a serious complication of MI, with a mortality rate approaching 90%. Fever is not a typical sign of cardiogenic shock. The other changes in vital signs on the client's chart are not as significant as the decreased urinary output. The nurse has completed an assessment of a client with a decreased cardiac output. Which findings should receive the highest priority? 1. BP 110/62, atrial fibrillation with heart rate 82, bibasilar crackles. 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. 3. Oxygen saturation 92% on 2 liters via nasal cannula, respirations 20, 1 plus edema of lower extremities. 4. Weight gain of 1 kilogram in 3 days, BP 130/80, mild dyspnea with exercise. The correct answer is 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. A low urine output and confusion are signs of decreased tissue perfusion. Orthopnea is a sign of left-sided heart failure. Crackles, edema, and weight gain should be monitored closely, but the levels are not as high a priority. With atrial fibrillation, there is a loss of atrial kick, but the blood pressure and heart rate are stable. The physician prescribes continuous IV nitroglycerin infusion for the client with myocardial infarction. The nurse should 1. Obtain an infusion pump for the medication. 2. Take the blood pressure every 4 hours. 3. Monitor urine output hourly. 4. Obtain serum potassium levels daily. The correct answer is 1. Obtain an infusion pump for the medication. IV nitroglycerin infusion requires an infusion pump for precise control of the medication. Blood pressure monitoring would be done with a continuous system and more frequently than every 4 hours. Hourly urine outputs are not always required. Obtaining serum potassium levels is not associated with nitroglycerin infusion. The nurse notices that a client's heart rate decreases from 63 to 50 beats per minute on the monitor. The nurse should first 1. Administer atropine 0.5 milligrams IV push. 2. Auscultate for abnormal heart sounds. 3. Prepare for transcutaneous pacing. 4. Take the client's blood pressure. The correct answer is 4. Take the client's blood pressure. The nurse should first assess the client's tolerance to the drop in heart rate by checking the blood pressure and level of consciousness and determine if atropine is needed. If the client is symptomatic, atropine and transcutaneous pacing are interventions for symptomatic bradycardia. Once the client is stable, further physical assessments can be done. The client is admitted to the telemetry unit due to chest pain. The client has polysubstance abuse, and the nurse assesses that the client is anxious and irritable and has moist skin. The nurse should do the following in which order from first to last. 1. Obtain a history of which drugs the client has used recently. 2. Administer the prescribed dose of morphine. 3. Position electrodes on the chest. 4. Take vital signs. The correct order is 3. Position electrodes on the chest. 4. Take vital signs. 2. Administer the prescribed dose of morphine. And 1. Obtain a history of which drugs the client has used recently. The nurse should first connect the client to the monitor by attaching the electrodes. Electrocardiography can be used to identify myocardial ischemia and infarction, rhythm and conduction disturbances, chamber enlargement, electrolyte imbalances, and the effects of drugs on the client's heart. The nurse next obtains vital signs to establish a baseline. Next, the nurse should administer the morphine. Morphine is the drug of choice in relieving myocardial infarction pain. It may cause a transient decrease in blood pressure. When the client is stable, the nurse can obtain a history of the client's drug use. A client is admitted with a myocardial infarction and atrial fibrillation. While auscultating the heart, the nurse notes an irregular heart rate and hears an extra heart sound at the apex after the S2 that remains constant throughout the respiratory cycle. The nurse should document these findings as 1. Heart rate irregular with S3. 2. Heart rate irregular with S4. 3. Heart rate irregular with aortic regurgitation. 4. Heart rate irregular with mitral stenosis. The correct answer is 1. Heart rate irregular with S3. An S3 heart sound occurs early in diastole as the mitral and tricuspid valves open and blood rushes into the ventricles. To distinguish an S3 from a physiologic S2 split, a split S2 occurs during inspiration, and S3 remains constant during the respiratory cycle. Its pitch is softer and best heard with the bell at the apex, and it is one of the first clinical findings in left ventricular failure. An S4 is heard in late diastole when atrial contraction pumps volume into a stiff, non-compliant ventricle. An S4 is not heard in a client with atrial fibrillation because there is no atrial contraction. Murmurs are sounds created by turbulent blood flow through an incompetent or stenotic valve. While caring for a client who has sustained a myocardial infarction, the nurse notes 8 premature ventricular contractions in 1 minute on the cardiac monitor. The client is receiving an IV infusion of 5% dextrose in water and oxygen at 2 liters per minute. The nurse's first course of action should be to 1. Increase the IV infusion rate. 2. Notify the physician promptly. 3. Increase the oxygen concentration. 4. Administer a prescribed analgesic. The correct answer is 2. Notify the physician promptly. PVCs are often a precursor of life-threatening arrhythmias, including ventricular tachycardia and ventricular fibrillation. An occasional PVC is not considered dangerous, but if PVCs occur at a rate greater than 5 or 6 per minute in the post-MI client, the physician should be notified immediately. More than 6 PVCs per minute is considered serious and usually calls for decreasing ventricular irritability by administering medications such as lidocaine hydrochloride. Increasing the IV infusion rate would not decrease the number of PVCs. Increasing the oxygen concentration should not be the nurse's first course of action. Rather, the nurse should notify the physician promptly. Administering a prescribed analgesic would not decrease ventricular irritability. A healthcare provider has just inserted nasal packing for a client with epistaxis. The client is taking ramipril for hypertension. What should the nurse instruct the client to do? 1. Use 81 milligrams of aspirin daily for relief of discomfort. 2. Omit the next dose of ramipril. 3. Remove the packing if there is difficulty swallowing. 4. Avoid rigorous aerobic exercise. The correct answer is 4. Avoid rigorous aerobic exercise. Epistaxis, or nosebleed, is a common, sudden emergency. Commonly, no apparent explanation for the bleeding is known. With significant blood loss, systemic symptoms such as vertigo, increased pulse, shortness of breath, decreased blood pressure, and pallor will occur. Because aerobic exercise may increase blood pressure and increased blood pressure can cause epistaxis, the client with hypertension should avoid it. Aspirin inhibits platelet aggregation, reducing the ability of the blood to clot. The client should continue to take his anti-hypertension medication, ramipril. Posterior nasal packing should be left in place for 1 to 3 days. A nurse is completing the health history for a client who has been taking echinacea for a head cold. The client asks, "Why isn't this helping me feel better?" Which of the following responses by the nurse would be the most accurate? 1. There is limited information as to the effectiveness of herbal products. 2. Antibiotics are the agents needed to treat a head cold. 3. The head cold should be gone within the month. 4. Combining herbal products with prescription antiviral medications is sure to help you. The correct answer is 1. There is limited information as to the effectiveness of herbal products. At this time, there is no strong research evidence to warrant recommendations of herbal products for management of colds. Further study is needed to show evidence of therapeutic effects and indications. Antibiotics are effective against bacteria. The head cold may have a viral cause. An uncomplicated upper respiratory tract infection subsides within 2 to 3 weeks. There may be a drug-drug interaction with herbal products and prescriptions. Which of the following activities should the nurse teach the client to implement after the removal of nasal packing on the second post-operative day? 1. Avoid cleaning the nares until swelling has subsided. 2. Apply water-soluble jelly to lubricate the nares. 3. Keep a nasal drip pad in place to absorb secretions. 4. Use a bulb syringe to gently irrigate nares. The correct answer is 2. Apply water-soluble jelly to lubricate the nares. After removal of nasal packing, the client should be instructed to apply water-soluble jelly to the nares to lubricate the nares and promote comfort. Swelling gradually subsides over several weeks. The client can gently clean the nares as soon as packing is removed. A nasal drip pad is not needed after removal of packing. Irrigation with a bulb syringe may interfere with healing and introduce infection. A nurse is teaching a client about taking antihistamines. Which of the following instructions should the nurse include in the teaching plan? Select all that apply. 1. Operating machinery and driving may be dangerous while taking antihistamines. 2. Continue taking antihistamines even if nasal infection develops. 3. The The effect of antihistamines is not felt until a day later. 4. Do not use alcohol with antihistamines. 5. Increase fluid intake to 2,000 milliliters per day. The correct answers are 1. Operating machinery and driving may be dangerous while taking antihistamines. 4. Do not use alcohol with antihistamines. And 5. Increase fluid intake to 2,000 milliliters per day. Antihistamines have an anticholinergic action and a drying effect and reduce nasal, salivary, and lacrimal gland hypersecretion, runny nose, tearing, and itching eyes. An adverse effect is drowsiness, so operating machinery and driving are not recommended. There is also an additive depressant effect when alcohol is combined with antihistamines, so alcohol should be avoided during antihistamine use. The client should ensure adequate fluid intake of at least 8 glasses per day due to the drying effect of the drug. Antihistamines have no antibacterial action. The effect of antihistamines is prompt, not delayed. A client has had surgery for a deviated nasal septum. Which of the following would indicate that bleeding was occurring even if the nasal drip pad remained dry and intact? 1. Nausea. 2. Repeated swallowing. 3. Increased respiratory rate. 4. Increased pain. The correct answer is 2. Repeated swallowing. Because of the dense nasal packing, bleeding may not be apparent through the nasal drip pad. Instead, the blood may run down the throat, causing the client to swallow frequently. The back of the throat, where the blood will be apparent, can be assessed with a flashlight. An accumulation of blood in the stomach can cause nausea and vomiting, but nausea would not be the initial indicator of bleeding. An increased respiratory rate occurs in shock, but is not an early sign of bleeding in a client who has undergone nasal surgery. Increased pain warrants further assessment, but is not an indicator of bleeding. An elderly client had posterior packing inserted to control a severe nosebleed. After insertion of the packing, the client should be closely monitored for which of the following complications? 1. Vertigo. 2. Bell's palsy. 3. Hypoventilation. 4. Loss of gag reflex. The correct answer is 3. Hypoventilation. Posterior packing may alter the respiratory status of the client, especially in elderly clients, causing hypoventilation. Clients should be observed carefully for changes in level of consciousness, respiratory rate, and heart rate and rhythm after the insertion of the packing. Vertigo does not occur as a result of the insertion of posterior packing. Bell's palsy, a disorder of the 7th cranial nerve, is not associated with epistaxis or nasal packing. Loss of gag reflex does not occur as a result of the insertion of posterior packing. A client with allergic rhinitis is instructed on the correct technique for using an intranasal inhaler. Which of the following statements would demonstrate to the nurse that the client understands the instructions? 1. I should limit the use of the inhaler to early morning and bedtime use. 2. It is important to not shake the canister because that can damage the spray device. 3. I should hold one nostril closed while I insert the spray into the other nostril. 4. The inhaler tip is inserted into the nostril and pointed toward the inside nostril wall. The correct answer is 3. I should hold one nostril closed while I insert the spray into the other nostril. When using an intranasal inhaler, it is important to close off one nostril while inhaling the spray into the other nostril to ensure the best inhalation of the spray. Use of the inhaler is not limited to mornings and bedtime. The canister should be shaken immediately before use. The inhaler tip should be inserted into the nostril and pointed toward the outside nostril wall to maximize inhalation of the medication. A client who has undergone outpatient nasal surgery is ready for discharge and has nasal packing in place. Which of the following discharge instructions would be appropriate for the client? 1. Avoid activities that elicit the Valsalva maneuver. 2. Take aspirin to control nasal discomfort. 3. Avoid brushing the teeth until the nasal packing is removed. 4. Apply heat to the nasal area to control swelling. The correct answer is 1. Avoid activities that elicit the Valsalva maneuver. The client should be instructed to avoid any activities that cause Valsalva's maneuver, such as constipation, vigorous coughing, exercise, in order to reduce bleeding and stress on suture lines. The client should not take aspirin because of its antiplatelet properties, which may cause bleeding. Oral hygiene is important to rid the mouth of old dried blood and to enhance the client's appetite. Cool compresses, not heat, should be applied to decrease swelling and control discoloration of the area. Which of the following would be an expected outcome for a client recovering from an upper respiratory tract infection? The client will 1. Maintain a fluid intake of 800 milliliters every 24 hours. 2. Experience chills only once a day. 3. Cough productively without chest discomfort. 4. Experience less nasal obstruction and discharge. The correct answer is 4. Experience less nasal obstruction and discharge. A client recovering from an upper respiratory tract infection should report decreasing or no nasal discharge and obstruction. Daily fluid intake should be increased to more than 1 liter every 24 hours to liquefy secretions. The temperature should be below 100 degrees Fahrenheit or 37.8 degrees Celsius with no chills or diaphoresis. A productive cough with chest pain indicates a pulmonary infection, not an upper respiratory tract infection. Which of the following statements should indicate to the nurse that a client has understood the discharge instructions provided after nasal surgery? 1. I should not shower until my packing is removed. 2. I will take stool softeners and modify my diet to prevent constipation. 3. Coughing every 2 hours is important to prevent respiratory complications. 4. It is important to blow my nose each day to remove the dried secretions. The correct answer is 2. I will take stool softeners and modify my diet to prevent constipation. Constipation can cause straining during defecation, which can induce bleeding. Showering is not contraindicated. The client should take measures to prevent coughing, which can cause bleeding. The client should avoid blowing the nose for 48 hours after the packing is removed. Thereafter, the client should blow the nose gently, using the open mouth technique to minimize bleeding in the surgical area. The nurse teaches the client how to instill nose drops. Which of the following techniques is correct? 1. The client uses sterile technique when handling the dropper. 2. The client blows the nose gently before instilling drops. 3. The client uses a new dropper for each installation. 4. The client sits in a semi-Fowler's position with the head tilted forward after administration of the drops. The correct answer is 2. The client blows the nose gently before instilling drops. The client should blow the nose before instilling nose drops. Instilling nose drops is a clean technique. The dropper should be cleaned after each administration, but it does not need to be changed. The client should assume a position that will allow the medication to reach the desired area. This is usually a supine position. The nurse is planning to give preoperative instructions to a client who will be undergoing rhinoplasty. Which of the following instructions should be included? 1. After surgery, nasal packing will be in place for 7 to 10 days. 2. Normal saline nose drops will need to be administered preoperatively. 3. The results of the surgery will be immediately obvious post-operatively. 4. Aspirin-containing medications should not be taken for 2 weeks before surgery. The correct answer is 4. Aspirin-containing medications should not be taken for 2 weeks before surgery. Aspirin-containing medications should be discontinued for 2 weeks before surgery to decrease the risk of bleeding. Nasal packing is usually removed the day after surgery. Normal saline nose drops are not routinely administered preoperatively. The results of the surgery will not be obvious immediately after surgery because of edema and ecchymosis. The nurse should include which of the following instructions in the teaching plan for a client with chronic sinusitis? 1. Avoid the use of caffeinated beverages. 2. Perform postural drainage every day. 3. Take hot showers twice daily. 4. Report a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius or higher. The correct answer is 3. Take hot showers twice daily. The client with chronic sinusitis should be instructed to take hot showers in the morning and evening to promote drainage of secretions. There is no need to limit caffeine intake. Performing postural drainage will inhibit removal of secretions, not promote it. Clients should elevate the head of the bed to promote drainage. Clients should report all temperatures higher than 100.4 degrees Fahrenheit or 38 degrees Celsius because a temperature that high can indicate infection. Which of the following assessments is a priority immediately after nasal surgery? 1. Assessing the client's pain. 2. Inspecting for periorbital ecchymosis. 3. Assessing respiratory status. 4. Measuring intake and output. The correct answer is 3. Assessing respiratory status. Immediately after nasal surgery, ineffective breathing patterns may develop as a result of the nasal packing and nasal edema. Nasal packing may dislodge, leading to obstruction. Assessing for airway obstruction is a priority. Assessing for pain is important, but it is not as high a priority as assessment of the airways. It is too early to detect ecchymosis. Measuring intake and output is not typically a priority nursing assessment after nasal surgery. A client with allergic rhinitis asks the nurse what to do to decrease the rhinorrhea. Which of the following instructions would be appropriate for the nurse to give the client? 1. Use your nasal decongestant spray regularly to help clear your nasal passages. 2. Ask the doctor for antibiotics. Antibiotics will help decrease the secretion. 3. It is important to increase your activity. A daily brisk walk will help promote drainage. 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. The correct answer is 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. It is important for clients with allergic rhinitis to determine the precipitating factors so that they can be avoided. Keeping a diary can help identify these triggers. Nasal decongestant sprays should not be used regularly because they can cause a rebound effect. Antibiotics are not appropriate for allergic rhinitis because an infection is not present. Increasing activity will not control the client's symptoms. In fact, walking outdoors may increase them if the client is allergic to pollen. After nasal surgery, the client expresses concern about how to decrease facial pain and swelling while recovering at home. Which of the following discharge instructions would be most effective for decreasing pain and edema? 1. Take analgesics every 4 hours around the clock. 2. Use corticosteroid nasal spray as needed to control symptoms. 3. Use a bedside humidifier while sleeping. 4. Apply cold compresses to the area. The correct answer is 4. Apply cold compresses to the area. Applying cold compresses helps to decrease facial swelling and pain from edema. Analgesics may decrease pain, but they do not decrease edema. A corticosteroid nasal spray would not be administered post-operatively because it can impair healing. Use of a bedside humidifier promotes comfort by providing moisture for nasal mucosa, but it does not decrease edema. Guaifenesin 300 mg 4 times a day has been prescribed as an expectorant. The dosage strength of the liquid is 200 mg per 5 milliliter. How many milliliters should the nurse administer for each dose? Blank milliliters. The correct answer is 7.5 milliliters. To solve this problem, you set up the formula as 200 milligrams over 5 milliliters equals to 300 milligrams over x. You cross-multiply 200 times x and 300 times 5. You get 200x equals to 1,500. You divide 200 on both sides, and you get x equals to 7.5 milliliters. This is the amount that the nurse should administer for each dose. A client is being discharged with nasal packing in place. The nurse should instruct the client to 1. Perform frequent mouth care. 2. Use normal saline nose drops daily. 3. Sneeze and cough with mouth closed. 4. Gargle every 4 hours with salt water. The correct answer is 1. Perform frequent mouth care. Frequent mouth care is important to provide comfort and encourage eating. Mouth care promotes moist mucous membranes. Nose drops cannot be used with nasal packing in place. When sneezing and coughing, the client should do so with the mouth open to decrease the chance of dislodging the packing. Gargling should not be attempted with packing in place. Pseudoephedrine has been prescribed as a nasal decongestant. Which of the following is a possible adverse effect of this drug? 1. Constipation. 2. Bradycardia. 3. Diplopia. 4. Restlessness. The correct answer is 4. Restlessness. Adverse effects of pseudoephedrine are experienced primarily in the cardiovascular system and through sympathetic effects on the central nervous system. The most common CNS adverse effects include restlessness, dizziness, tension, anxiety, insomnia, and weakness. Common cardiovascular adverse effects include tachycardia, hypertension, palpitations, and arrhythmias. Constipation and diplopia are not adverse effects of pseudoephedrine. Tachycardia, not bradycardia, is an adverse effect of pseudoephedrine. The nurse is teaching a client how to manage a nosebleed. Which of the following instructions would be appropriate to give the client? 1. Tilt your head backward and pinch your nose. 2. Lie down flat and place an ice compress over the bridge of the nose. 3. Blow your nose gently with your neck flexed. 4. Sit down, lean forward, and pinch the soft portion of your nose. The correct answer is 4. Sit down, lean forward, and pinch the soft portion of your nose. The client should assume a sitting position and lean forward. Firm pressure should be applied to the soft portion of the nose for approximately 10 minutes. Tilting the head backward can cause the client to swallow blood, which can obscure the amount of bleeding and also can lead to nausea. Ice compresses may be applied, but the client should not lie flat. Blowing the nose is to be avoided because it can increase bleeding. The nurse is teaching a client about risk factors associated with atherosclerosis and how to reduce the risk. Which of the following is a risk factor that the client is not able to modify? 1. Diabetes. 2. Age. 3. Exercise level. 4. Dietary preferences. The correct answer is 2. Age. Age is a non-modifiable risk factor for atherosclerosis. The nurse instructs the client to manage modifiable risk factors such as comorbid diseases, such as diabetes, activity level, and diet. Controlling serum blood glucose levels, engaging in regular aerobic activity, and choosing a diet low in saturated fats can reduce the risk of developing atherosclerosis. The nurse is assessing a 48-year-old client with a history of smoking during a routine clinic visit. The client, who exercises regularly, reports having pain in the calf during exercise that disappears at rest. Which of the following findings requires further evaluation? 1. Heart rate 57 beats per minute. 2. Oxygen saturation of 94% on room air. 3. Blood pressure 134/82. 4. Ankle brachial index of 0.65. The correct answer is 4. Ankle brachial index of 0.65. An ankle brachial index of 0.65 suggests moderate arterial vascular disease in a client who is experiencing intermittent claudication. A Doppler ultrasound is indicated for further evaluation. The bradycardic heart rate is acceptable in an athletic client with a normal blood pressure. The oxygen saturation is acceptable. The client has a smoking history. A client has peripheral vascular disease of the lower extremities. The client tells the nurse, "I've really tried to manage my condition well." Which of the following routines should the nurse evaluate as having been appropriate for this client? 1. Resting with the legs elevated above the level of the heart. 2. Walking slowly but steadily for 30 minutes twice a day. 3. Minimizing activity. 4. Wearing anti-embolism stockings at all times when out of bed. The correct answer is 2. Walking slowly but steadily for 30 minutes twice a day. Slow, steady walking is a recommended activity for clients with peripheral vascular disease because it stimulates the development of collateral circulation. The client with PVD should not remain inactive. Elevating the legs above the heart or wearing anti-embolism stockings is a strategy for alleviating venous congestion and may worsen peripheral arterial disease. A client with peripheral vascular disease has undergone a right femoral popliteal bypass graft. The blood pressure has decreased from 124/80 to 94/62. What should the nurse assess first? 1. IV fluid solution. 2. Pedal pulses. 3. Nasal cannula flow rate. 4. Capillary refill. The correct answer is 2. Pedal pulses. With each set of vital signs, the nurse should assess the dorsalis pedis and posterior tibial pulses. The nurse needs to ensure adequate perfusion to the lower extremity with the drop in blood pressure. IV fluids, nasal cannula setting, and capillary refill are important to assess. However, priority is to determine the cause of drop in blood pressure and that adequate perfusion through the new graft is maintained. The nurse is assessing the lower extremities of the client with peripheral vascular disease. During the assessment, the nurse should expect to find which of the following clinical manifestations of PVD? Select all that apply. 1. Hairy legs. 2. Mottled skin. 3. Pink skin. 4. Coolness. 5. Moist skin. The correct answers are 2. Mottled skin and 4. Coolness. Reduction of blood flow to a specific area results in decreased oxygen and nutrients. As a result, the skin may appear mottled. The skin will also be cool to the touch. Loss of hair and dry skin are other signs that the nurse may observe in a client with PVD of the lower extremities. A client is scheduled to have an arteriogram. During the arteriogram, the client reports having nausea, tingling, and dyspnea. The nurse's immediate action should be to 1. Administer epinephrine. 2. Inform the physician. 3. Administer oxygen. 4. Inform the client that the procedure is almost over. The correct answer is 2. Inform the physician. Clients may have an immediate or a delayed reaction to the radiopaque dye. The physician should be notified immediately because the symptoms suggest an allergic reaction. Treatment may involve administering oxygen and epinephrine. Explaining that the procedure is over does not address the current symptoms. An overweight client taking warfarin has dry skin due to decreased arterial blood flow. What should the nurse instruct the client to do? Select all that apply. 1. Apply lanolin or petroleum jelly to intact skin. 2. Follow a reduced-calorie, reduced-fat diet. 3. Inspect the involved areas daily for new ulcerations. 4. Instruct the client to limit activities of daily living. 5. Use an electric razor to shave. The correct answers are 1. Apply lanolin or petroleum jelly to intact skin. 2. Follow a reduced-calorie, reduced-fat diet. 3. Inspect the involved areas daily for new ulcerations. And 5. Use an electric razor to shave. Maintaining skin integrity is important in preventing chronic ulcers and infections. The client should be taught to inspect the skin on a daily basis. The client should reduce weight to promote circulation. A diet lower in calories and fat is appropriate. Because the client is receiving Coumadin, the client is at risk for bleeding from cuts. To decrease the risk of cuts, the nurse should suggest that the client use an electric razor. The client with decreased arterial blood flow should be encouraged to participate in ADLs. In fact, the client should be encouraged to consult an exercise physiologist for an exercise program that enhances the aerobic capacity of the body. The nurse is unable to palpate the client's left pedal pulses. Which of the following actions should the nurse take next? 1. Auscultate the pulses with a stethoscope. 2. Call the physician. 3. Use a Doppler ultrasound device. 4. Inspect the lower left extremity. The correct answer is 3. Use a Doppler ultrasound device. When pedal pulses are not palpable, the nurse should obtain a Doppler ultrasound device. Auscultation is not likely to be helpful if the pulse isn't palpable. Inspection of the lower extremity can be done simultaneously when palpating, but the nurse should first try to locate a pulse by Doppler. Calling the physician may be necessary if there is a change in the client's condition. The nurse is caring for a client with peripheral artery disease who has recently been prescribed clopidogrel. The nurse understands that more teaching is necessary when the client states which of the following. 1. I should not be surprised if I bruise easier or if my gums bleed a little when brushing my teeth. 2. It doesn't really matter if I take this medicine with or without food, whatever works best for my stomach. 3. I should stop taking Plavix if it makes me feel weak and dizzy. 4. The doctor prescribed this medicine to make my platelets less likely to stick together and help prevent clots from forming. The correct answer is 3. I should stop taking Plavix if it makes me feel weak and dizzy. Weakness, dizziness, and headache are common adverse effects of Plavix, and the client should report these to the physician if they are problematic. In order to decrease risk of clot formation, Plavix must be taken regularly and should not be stopped or taken intermittently. The main adverse effect of Plavix is bleeding, which often occurs as increased bruising or bleeding when brushing teeth. Plavix is well absorbed, and while food may help decrease potential gastrointestinal upset, Plavix may be taken with or without food. Plavix is an antiplatelet agent used to prevent clot formation in clients who have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome. Which of the following lipid abnormalities is a risk factor for the development of atherosclerosis and peripheral vascular disease? 1. Low concentration of triglycerides. 2. High levels of high-density lipid cholesterol. 3. High levels of low-density lipid cholesterol. 4. Low levels of LDL cholesterol. The correct answer is 3. High levels of low-density lipid cholesterol. An increased LDL cholesterol concentration has been documented as a risk factor for the development of atherosclerosis. LDL cholesterol is not broken down in the liver, but is deposited into the intima of the blood vessels. Low triglyceride levels are desirable. High HDL and low LDL levels are beneficial and are known to be protective for the cardiovascular system. A client is receiving cilostazol for peripheral arterial disease, causing intermittent claudication. The nurse determines this medication is effective when the client reports which of the following? 1. I am having fewer aches and pains. 2. I do not have headaches anymore. 3. I am able to walk further without leg pain. 4. My toes are turning grayish-black in color. The correct answer is 3. I am able to walk further without leg pain. Cilostazol is indicated for management of intermittent claudication. Symptoms usually improve within 2 to 4 weeks of therapy. Intermittent claudication prevents clients from walking for long periods of time. Cilostazol inhibits platelet aggregation induced by various stimuli and improving blood flow to the muscles and allowing the client to walk long distances without pain. Peripheral arterial disease causes pain mainly of the leg muscles. Aches and pains does not specify exactly where the pain is occurring. Headaches may occur as a side effect of this drug, and the client should report this information to the healthcare provider. Peripheral arterial disease causes decreased blood supply to the peripheral tissues and may cause gangrene of the toes. The drug is effective when the toes are warm to the touch and the color of the toes is similar to the color of the body. When assessing an individual with peripheral vascular disease, which clinical manifestation would indicate complete arterial obstruction in the lower left leg? 1. Aching pain in the left calf. 2. Burning pain in the left calf. 3. Numbness and tingling in the left leg. 4. Coldness of the left foot and ankle. The correct answer is 4. Coldness of the left foot and ankle. Coldness in the left foot and ankle is consistent with complete arterial obstruction. Other expected findings would include paralysis and pallor. Aching pain, a burning sensation, or numbness and tingling are earlier signs of tissue hypoxia and ischemia, and are commonly associated with incomplete obstruction. The client admitted with peripheral vascular disease asks the nurse why her legs hurt when she walks. The nurse bases a response on the knowledge that the main characteristic of PVD is 1. Decreased blood flow. 2. Increased blood flow. 3. Slow blood flow. 4. Thrombus formation. The correct answer is 1. Decreased blood flow. Decreased blood flow is a common characteristic of all PVD. When the demand for oxygen to the working muscles becomes greater than the supply, pain is the outcome. Slow blood flow throughout the circulatory system may suggest pump failure. Thrombus formation can result from stasis or damage to the intima of the vessels. A client with peripheral vascular disease returns to the surgical care unit after having femoral popliteal bypass grafting. indicate in which order the nurse should conduct assessment of this client. 1. Post-operative pain. 2. Peripheral pulses. 3. Urine output. 4. Incision site. The correct order is 2. Peripheral pulses. 4. Incision site. 3. Urine output. And 1. Post-operative pain. Because assessment of the presence and quality of the pedal pulses in the affected extremity is essential after surgery to make sure that the bypass graft is functioning, this step should be done first. The nurse should next ensure that the dressing is intact, and then that the client has adequate urine output. Lastly, the nurse should determine the client's level of pain. The nurse is planning care for a client who is diagnosed with peripheral vascular disease and has a history of heart failure. The nurse should develop a plan of care that is based on the fact that the client may have a low tolerance for exercise related to 1. Decreased blood flow. 2. Increased blood flow. 3. Decreased pain. 4. Increased blood viscosity. The correct answer is 1. Decreased blood flow. A client with PVD and heart failure will experience decreased blood flow. In this situation, low exercise tolerance may be related to less blood being ejected from the left ventricle into the systemic circulation. Decreased blood supply to the tissues results in pain. Increased blood viscosity may be a component, but it is of much less importance than the disease processes. A client with heart failure has bilateral +4 edema of the right ankle that extends up to the midcalf. The client is sitting in a chair with the legs in a dependent position. Which of the following goals is the priority? 1. Decrease venous congestion. 2. Maintain normal respirations. 3. Maintain body temperature. 4. Prevent injury to lower extremities. The correct answer is 1. Decrease venous congestion. Decreasing venous congestion in the extremities is a desired outcome for clients with heart failure. The nurse should elevate the client's legs above the level of the heart to achieve this goal. The client is not demonstrating difficulty breathing or being cold. The nurse should prevent injury to the swollen extremity. However, this is not the priority. When assessing the lower extremities of a client with peripheral vascular disease, the nurse notes bilateral ankle edema. The edema is related to 1. Competent venous valves. 2. Decreased blood volume. 3. Increase in muscular activity. 4. Increased venous pressure. The correct answer is 4. Increased venous pressure. In PVD, decreased blood flow can result in increased venous pressure. The increase in venous pressure results in an increase in capillary hydrostatic pressure, which causes a net filtration of fluid out of the capillaries into the interstitial space, resulting in edema. Valves often become incompetent with PVD. Blood volume is not decreased in this condition. Decreased muscular action would contribute to the formation of edema in the lower extremities. The nurse is assessing an older Caucasian male who has a history of peripheral vascular disease. The nurse observes that the man's left great toe is black. The discoloration is probably a result of 1. Atrophy. 2. Contraction. 3. Gangrene. 4. Rubor. The correct answer is 3. Gangrene. The term gangrene refers to blackened, decomposing tissue that is devoid of circulation. Chronic ischemia and death of the tissue can lead to gangrene in the affected extremity. Injury, edema, and decreased circulation lead to infection, gangrene, and tissue death. Atrophy is the shrinking of tissue, and contraction is joint stiffening secondary to disuse. The term rubor denotes a reddish color of the skin. The nurse is obtaining the pulse of a client who had a femoral popliteal bypass surgery 6 hours ago. Which assessment provides the most accurate information about the client's post-operative status? 1. 2. 3. 4. The correct answer is option 4. The presence of a strong dorsalis pedis pulse indicates that there is circulation to the extremity distal to the surgery, indicating that the graft between the femoral and popliteal artery is allowing blood to circulate effectively. Option 1 shows the nurse obtaining the radial pulse. Option 2 shows the femoral pulse, which is proximal to the surgery site, and will not indicate circulation distal to the surgery site. Option 3 shows the nurse obtaining an apical pulse. A client is scheduled for an arteriogram. The nurse should explain to the client that the arteriogram will confirm the diagnosis of occlusive arterial disease by 1. Showing the location of the obstruction and the collateral circulation. 2. Scanning the affected extremity and identifying the areas of volume changes. 3. Using ultrasound to estimate the velocity changes in the blood vessels. 4. Determining how long the client can walk. The correct answer is 1. Showing the location of the obstruction and the collateral circulation. An arteriogram involves injecting a radiopaque contrast agent directly into the vascular system to visualize the vessels. It usually involves computed tomographic scanning. The velocity of the blood flow can be estimated by duplex ultrasound. The client's ankle brachial index is determined, and then the client is requested to walk. The normal response is little or no drop in ankle systolic pressure after exercise. A client who has had the jaws wired begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. Suction the client's airway as needed. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, but these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort or in case of respiratory or cardiac arrest. A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2. Wire cutters and 4. Suction equipment. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code cart is not needed at the bedside. A client with peptic ulcer disease is taking a histamine 2 receptor antagonists. What is the expected outcome of this drug? 1. Heal the ulcer. 2. Protect the ulcer surface from acids. 3. Reduce acid concentration. 4. Limit gastric acid secretion. The correct answer is 4. Limit gastric acid secretion. Histamine 2 receptor antagonists reduce gastric acid secretion. Antisecretory or proton pump inhibitors, such as omeprazole, help ulcers heal quickly in 4 to 8 weeks. Cytoprotective drugs, such as sucralfate, protect the ulcer surface against acid, bile, and pepsin. Antacids reduce acid concentration and help reduce symptoms. Which of the following interventions is most appropriate for a client who has stomatitis? 1. Drinking hot tea at frequent intervals. 2. Gargling with antiseptic mouthwash. 3. Using an electric toothbrush. 4. Eating a soft, bland diet. The correct answer is 4. Eating a soft, bland diet. Clients with stomatitis, inflammation of the mouth, have significant discomfort, which impacts their ability to eat and drink. They will be most comfortable eating soft, bland foods and avoiding temperature extremes in their food and liquids. Gargling with an antiseptic mouthwash will be irritating to the mucosa. Mouth care should include gentle brushing with a soft toothbrush and flossing. A nurse teaches a client experiencing heartburn to take 1.5 ounces of Mulox when symptoms appear. How many milliliters should the client take? Blank milliliters. The correct answer is 45 milliliters. 1 ounce equals to 30 milliliters. To solve this problem, you set up the formula as 1 ounce over 30 milliliters equals to 1.5 ounces over X. You cross-multiply 1 times x and 30 times 1.5. You get 1x equals to 45. You divide by 1 on both sides, and you get x equals to 45 milliliters. A client with peptic ulcer disease reports being nauseated most of the day and now feeling lightheaded and dizzy. Based upon these findings, which nursing actions would be most appropriate for the nurse to take? Select all that apply. 1. Administering an antacid hourly until nausea subsides. 2. Monitoring the client's vital signs. 3. Notifying the physician of the client's symptoms. 4. Initiating oxygen therapy. 5. Reassessing the client in an hour. The correct answers are 2. Monitoring the client's vital signs, and 3. Notifying the physician of the client's symptoms. The symptoms of nausea and dizziness in a client with peptic ulcer disease may be indicative of hemorrhage and should not be ignored. The appropriate nursing actions at this time are for the nurse to monitor the client's vital signs and notify the physician of the client's symptoms. To administer an antacid hourly or to wait 1 hour to reassess the client would be inappropriate. Prompt intervention is essential in a client who is potentially experiencing a gastrointestinal hemorrhage. The nurse would notify the physician of assessment findings and then initiate oxygen therapy if prescribed by the physician. A client who has a history of mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition. The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. The correct order is 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. And 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with the fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client who is NPO for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery. Amoxicillin trihydrate 300 mg PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 mg per 5 milliliters. How many milliliters should the nurse administer? Blank milliliters. The correct answer is 6 milliliters. To solve this problem, you set up the formula as 250 milligrams over 5 milliliters equals to 300 milligrams over x. You cross-multiply 250 times x and 300 times 5. You get 250x equals to 1,500. You divide 200 on both sides, and you get x equals to 6 milliliters. This is the amount that the nurse should administer for each dose. The nurse is caring for a client who has just had an upper GI endoscopy. The client's vital signs must be taken every 30 minutes for 2 hours after the procedure. The nurse assigns an unlicensed nursing personnel to take the vital signs. 1 hour later, the UAP reports the client, who was previously hay-febrile, has developed a temperature of 101.8 degrees Fahrenheit. What should the nurse do in response to these reported assessment data? 1. Promptly assess the client for potential perforation. 2. Tell the assistant to change the thermometers and retake the temperature. 3. Plan to give the client acetaminophen to lower the temperature. 4. Ask the UAP to bathe the client with tepid water. The correct answer is 1. Promptly assess the client for potential perforation. A sudden spike in temperature following an endoscopic procedure may indicate perforation of the GI tract. The nurse should promptly conduct a further assessment of the client, looking for further indicators of perforation, such as a sudden onset of acute upper abdominal pain, a rigid, board-like abdomen, and developing signs of shock. Telling the assistant to change the thermometers is not an appropriate action and only further delays the appropriate action of assessing the client. The nurse would not administer acetaminophen without further assessment of the client or without a physician's prescription. A suspected perforation would require that the client be placed on nothing-by-mouth status. Asking the assistant to bathe the client before any assessment by the nurse is inappropriate. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. Encourage the client to suck on hard candy. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, inflammation of the mouth, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and the nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occur during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is the priority at this time. A client is admitted to the hospital after vomiting bright red blood and is diagnosed with a bleeding duodenal ulcer. The client develops a sudden sharp pain in the mid-epigastric region along with a rigid, board-like abdomen. The nurse should do which of the following first? 1. Administer pain medication as prescribed. 2. Raise the head of the bed. 3. Prepare to insert a nasogastric tube. 4. Notify the physician. The correct answer is 4. Notify the physician. The client is experiencing a perforation of the ulcer, and the nurse should notify the physician immediately. The body reacts to perforation of an ulcer by immobilizing the area as much as possible. This results in board-like abdominal rigidity, usually with extreme pain. Perforation is a medical emergency requiring immediate surgical intervention because peritonitis develops quickly after perforation. Administering pain medication is not the first action, although the nurse later should institute measures to relieve pain. Elevating the head of the bed will not minimize perforation. A nasogastric tube may be used following surgery. The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Use of alcohol. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation, such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun, lip cancer, and syphilis. Use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer. When obtaining a nursing history from a client with a suspected gastric ulcer, which signs and symptoms should the nurse assess? Select all that apply. 1. Epigastric pain at night. 2. Relief of epigastric pain after eating. 3. Vomiting. 4. Weight loss. 5. Melena. The correct answers are 3. Vomiting, 4. Weight loss, and 5. Melena. Vomiting and weight loss are common with gastric ulcers. The client may also have blood in the stools, which is melena, from gastric bleeding. Clients with a gastric ulcer are most likely to have a burning epigastric pain that occurs about 1 hour after eating. Eating frequently aggravates the pain. Clients with duodenal ulcers are more likely to have pain that occurs during the night and is frequently relieved by eating. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you will be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation. The nurse is caring for a client who has had a gastroscopy. Which of the following may indicate that the client is developing a complication related to the procedure? Select all that apply. 1. The client has a sore throat. 2. The client has a temperature of 100 degrees Fahrenheit. 3. The client appears drowsy following the procedure. 4. The client has epigastric pain. 5. The client experiences hematemesis. The correct answers are 2. The client has a temperature of 100 degrees Fahrenheit. 4. The client has epigastric pain. And 5. The client experiences hematemesis. Following a gastroscopy, the nurse should monitor the client for complications, which include perforation and the potential for aspiration. An elevated temperature, epigastric pain, or the vomiting of blood are all indications of a possible perforation and should be reported promptly. A sore throat is a common occurrence following a gastroscopy. Clients are usually sedated to decrease anxiety, and the nurse would anticipate that the client will be drowsy following the procedure. A client who is in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate post-operative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. Maintain a patent airway. The priority of care in the immediate post-operative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important. A client admitted to the hospital with peptic ulcer disease tells the nurse about having black tarry stools. The nurse should 1. Encourage the client to increase fluid intake. 2. Advise the client to avoid iron-rich foods. 3. Place the client on contact precautions. 4. Report the finding to the healthcare provider. The correct answer is 4. Report the finding to the healthcare provider. Black tarry stools are an important warning sign of bleeding in peptic ulcer disease. Digested blood in the stool causes it to be black. The odor of the stool is very offensive. The nurse should instruct the client to report the incidence of black stools promptly to the primary healthcare provider. Increasing fluids or avoiding iron-rich foods will not change the stool color or consistency if the stools contain digested blood. Until other information is available, it is not necessary to initiate contact precautions. A client has returned from surgery during which the jaws were wired as treatment for a fractured mandible. The client is in a stable condition. The nurse is instructing the unlicensed nursing personnel on how to properly position the client. Which instructions about positioning would be appropriate for the nurse to give the UAP? 1. Keep the client in a side-lying position with the head slightly elevated. 2. Do not reposition the client without the assistance of a nurse. 3. The client can assume any position that is comfortable. 4. Keep the client's head elevated on 2 pillows at all times. The correct answer is 1. Keep the client in a side-lying position with the head slightly elevated. Immediately after surgery, the client should be placed on the side with the head slightly elevated. This position helps facilitate removal of secretions and decreases the likelihood of aspiration should vomiting occur. A nurse does not need to be present to reposition the client unless the client's condition warrants the presence of the nurse. Although it is important to elevate the head, there is no need to keep the client's head elevated on 2 pillows unless that position is comfortable for the client. A client with a peptic ulcer reports epigastric pain that frequently causes the client to wake up during the night. The nurse should instruct the client to do which activities? Select all that apply. 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. 4. Sit up for 1 hour when awakened at night. 5. Stay away from crowded areas. The correct answers are 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. And 4. Sit up for 1 hour when awakened at night. The nurse should encourage the client to reduce stimulation that may enhance gastric secretion. The nurse can also advise the client to utilize health practices that will prevent recurrences of ulcer pain, such as avoiding fatigue and elimination of smoking. Eating small, frequent meals helps to prevent gastric distension if not actively bleeding and decreases distension and release of gastrin. Medications should be administered promptly to maintain optimum levels. After awakening during the night, the client should eat a small snack and return to bed, keeping the head of the bed elevated for an hour after eating. It is not necessary to stay away from crowded areas.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.